Hello, I'm Dr. William Inman. I'm the person that does frequency-specific low-level laser therapy. Spent the last 20 years of my life dedicating myself to figuring out frequency-specific applications for disease conditions for dogs, cats, horses, and humans, essentially. Today's mini lecture is about teeth and teeth pain, and also pyorrhea and gingivitis. These conditions almost always occur because lack of blood supply to the maxilla and mandible in the dog, cat, and horse especially, but also in the human being. And our goal, of course, is to increase the blood supply, nerve supply, and also lymphatic drainage to those tissues to try to ameliorate a pain and also the progression of pyorrhea and gingivitis. The laser has actually 3 different protocols for tooth pain chronic, tooth pain acute, and also tooth pain veterinary, essentially. And also it has 2 gingivitis protocols, which are basically applicable for the condition of gingivitis in the dog, cat, horse, and human. And also for pyorrhea, there are 3 different protocols for treating pyorrhea. Very common is pyorrhea in the canine. We treat the pyorrhea in the canine by lasering, usually from the bottom. Same thing with the human being. We can do it from the side, essentially, and therein lies the application. Usually 60 seconds per protocol. Sometimes we'll use several protocols, essentially, to resolve the problems. For the human being, what we'll do is we will lase at the face, usually on the side, or from underneath, essentially. We're trying to avoid the eyes. A lot of times we'll use a coverage for the eyes when we laser the face because we want to make sure that we don't lase the eyes. However, we're not using power level more than about 225 to 375 milliwatts, which can't theoretically damage the retina, but we don't take chances. A personal story of mine is that about 3 years ago I was suffering from severe wisdom tooth problem. It's horrible, horrible pain, essentially. It was a 10 out of 10. It was so bad that I was trying to use Tylenol and aspirin and whatever else, and also opiates to try to make the pain go away. It was screaming pain, essentially. So I called my dentist. Of course, it was Friday, and the dentist, of course, was gone. Wouldn't be back till Monday. And so I was feeling sorry for myself, wanting to go to emergency, and I realized that I had a frequency-specific laser, which I, of course, used. And inside of 5 minutes, I was out of pain, and within 20 minutes, I was completely out of pain, which I thought was miraculous and also coincidental. Didn't think much of it, but I decided that I would make an appointment and go see my dentist on Monday. On Monday, I was fine, so I said, well, that must have been transitory. I'm not going to do that. The following Friday, I had the pain back again. Picked up the phone, called my dentist. The dentist, of course, isn't there, wants me to make an appointment on Monday, of course, and I suggested to myself I will, but I had my trusty laser, so I used the laser again, and in about 5 minutes, I'm out of pain. In about 20 minutes, I'm completely out of pain, which was a good thing. So on Monday, when instead of making the appointment, I didn't go, and the following Friday, and this is the 3rd Friday in a row, I ended up having the same exact pain. It was like almost hilarious that I'm going to have this every Friday evening. So now what I did was I went ahead and lasered myself, of course, because I knew that would take away the pain, using frequencies for toothache, which there's about 10 of them, 12 of them that we utilize in these protocols. And then I did, in fact, make an appointment on Monday. And I went in on Monday to my dentist, and my dentist looked in my mouth, and he took a periosteal elevator, which is just kind of like a pry bar, and he reached underneath my wisdom tooth and pried it right out without anesthesia. It was just sitting there on top of the gum. It had rotted out of my mouth. In other words, it had abscessed over those 3-week period of time, and I was able to maintain essentially that abscessation problem out of pain for 3 weeks until it basically rotted the tooth out of my mouth. Now, I know that's disgusting, but I think it's imperative to realize that we're able to deal with acute tooth pain, which we experience in the human being more than we do in the dog, the cat, and the horse. However, our goal, of course, is to remove the pain, but also increase the blood supply and rehabilitate and kill the bacteria that are growing opportunistically in those particular conditions. So this is what we use for anything involving the mouth: gingivitis, accumulation of tartar, essentially pyorrhea, and teeth pain. Also extraction pain is used with this instrument. It's particularly effective. This device can be had through me. This device basically won't treat these conditions unless it has the protocols. There are 1,800 different protocols in this particular instrument, of which I've given you 6 of them. There's 8 of them, essentially. And we utilize some of them, or not all of them, if the problem is particularly severe when we're talking about pain and rib pain. In the meantime, there are 1,800 other protocols, and they treat thousands of different disease conditions. If you have any questions about treating chronic disease conditions in the mouth of the dog, cat, horse, and human, please feel free to contact me at 208-640-3430. That's a cell phone Pacific time. Or contact me at drbill at vomtech.com. This particular instrument, $7,600, but it is a lifesaver. Of the 687 of these we've sent home, not one has come back in the last 2 years since we started sending them home. We get nothing but rave reviews about its application. It has changed, essentially, therapy in veterinary medicine, essentially, and will soon change therapy in human medicine, too, when people discover it. So feel free to contact me. I'm Dr. Bill Inman, and thank you very much for your attention, and have a good day.